Everyone happy we go ahead with this?
The operating theatre, a place of hope and fear.
A lot of people are really intimidated and really scared of coming into hospital.
I'm starting to freak out a little bit.
No, I love you, don't you?
Yes, I do.
For the first time ever, an NHS day surgery unit and its staff have been rigged with cameras.
You've got a camera on your head.
I'm going to be filming you.
It's never a boring place to be.
Capturing a hard-working, close-knit team.
Welcome to our theatre.
Just had a birthday. Did you have cake?
Yeah.
Did you?
Yeah.
We'll get you back to the ward for a nice cup of tea.
Performing hundreds of complex operations every week.
I like fixing things.
Hey!
It gets your heart rate going.
Whoa, 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 whoa.
Can I have some help, please?
Changing patients' lives.
Stand clear, please.
Inside the operating theatre.
Look at that. That must be a world record.
Oh! We have a really good thing, me and Katie Lockwood. We have a little greeting that we do every morning.
Ah! Konnichiwa! Sayonara!
Katie asked me if I would like to go to bingo, which was on a Wednesday evening. And I said to her that I couldn't go to bingo on a Wednesday evening because I do classes. And she said, "Are you learning to talk Japanese then?" And I said, "No, I do exercise classes." So then the next morning, I said to her, "Konnichiwa," and then it's just gone on from there.
Wait.
The Queen Elizabeth Hospital in King's Lynn. It's 8:15 in the morning.
You tired?
Yeah.
Yes. Can you tell the lady what your name is?
Casey.
And how old is Casey?
I don't know.
You do know. Are you 4? Yeah. What are the doctors going to do today?
It's my.
They're going to fix your eye. What are they going to do?
I don't know.
You don't know? I think they're going to fix it so you can see properly, aren't they? Yeah? Casey was born with a condition called Ptosis, where her eyelid droops over her pupil. It's worse when she's tired, and it can affect her vision quite badly. And it has affected her vision more recently, so they decided that now's the time to get it done.
Paediatric nurse Chris will look after Casey.
Casey Lou? Hello, hi. Come on through.
Here we go. They're going to tighten up the muscles in the eyelid just to lift it slightly. And it doesn't always work the way they want it to, because there could still be a slight gap when her eyes are closed, but hopefully it should be all fine.
Are you nervous? Are you okay? So you've come to see the doctor today, haven't you? Yeah? Come to have a little look at your eye to make you even more beautiful.
Yes.
Yes.
Getting hurting.
It's been hurting, has it? We're going to make it feel better.
Hiya.
Morning.
You alright?
Yep.
Good. What's the name?
Matthew Clark.
That's lovely. If you just take a seat, they'll be with you shortly.
Lovely, thank you. Yeah, I think I'm probably on first name terms with most of the staff here or at Norwich. One of them hazards, I suppose, playing a contact sport. Did you have chocolate sprinkles on it?
He has broken quite a few bones. I worry about him all the time playing rugby, so I attend all matches because then I'm there at the sideline and everything.
Playing rugby, I've broken 4 collarbones, fractured sternum, fractured foot, and various other injuries. It doesn't hurt.
No.
Feels like I pushed out. Broke my nose last Thursday during a training session. One of my players' knees come straight across my face, and straight away you hear the crack of the nose and realise that, yeah, this isn't where it should be.
I'm going to steal this.
Staff nurse Katie will be looking after Matthew on the ward.
Good morning.
Morning.
Do we have Matthew Clark?
Yes.
Ah, lovely. Come with me.
You coming as well? Come on in.
Can you manage? All right, good morning.
You all right?
Come on through.
Matthew, with all of his injuries, I sort of returned to hospitals quite a few times, but yeah, it's just I get very nervous around them and yeah, not keen on them.
My name's Katie, okay. Do you have any allergies to anything?
Nope.
Not as far as you know?
Nope.
Great, all right, I'll go get the white ones. Just
good.
one sec.
Your Costa smells so good. It's like torture.
When did you do this? God, I can see
Last-
you've still got a little bit
Last
there.
Thursday, and this is better than what it was.
Yeah, the swelling would make things look worse as well.
And you had really bad black eye.
Yeah, they come down now. So.
Good. All right.
Yep.
Okay. We promise not to give you a different style nose, don't worry.
Not going to like turn it up and make
Yeah.
it look like Michael Jackson or anything like that.
Right.
It's Matt's sister's wedding coming up in a few days, so depending on how the operation goes, he might have to have like some sort of mould to cover his nose, and I'm expecting some black bruised eyes as well, so may not look too great on photos.
You got a wedding, you say?
Saturday.
Have you? Oh, bless you.
So try not to make any bruising.
You might bruise and you might have a dressing there. You might not by then.
Put some makeup on.
Oh my God. You have to use some of your girlfriend's
Concealer.
concealer.
Yeah, brilliant. That's going to look good, isn't it?
It works a treat. All right, whatever works for you.
Four-year-old Casey is on the paediatric eye list.
We need to go back in the car now.
You want to go back in the car? Oh, look.
Gonna wear my pen went.
Ophthalmic Surgeon Mr Bard will perform the operation.
Very brave of you to give it to me, so you'll never see it again. Come and chase it.
I will.
It is a challenge working with children. I'm a father of 2 young children myself, so I do know what they're like. And in a hospital environment, you do have to behave differently and try and put that child at ease to try and make them comfortable and make them realise you're somebody that's not going to hurt them. Right, good morning, Casey. How are you?
On your comfy chair.
You remember me from clinic? Yeah, just about. All right. So a ptosis is a defect in the levator muscle, and that's the muscle that will lift up the upper eyelid. It's quite an intricate operation. There's nerve fibres in there and blood vessels, and all can look very similar to each other once you open up the skin to look inside. Casey will notice a significant improvement in the opening of her eye on that side, and hopefully an improvement in her ability to see. There's a minimal scar because we place it into the skin crease, so you'll barely see it. The height of the eyelid, because it's under general anaesthetic, we can't guarantee that it's absolutely matched to the other side.
Yeah.
So further surgery to adjust that is possible.
Okay.
It's rare, but it's possible.
Yeah.
Have you got any questions? Anything to ask me? Yeah, what are you going to ask me?
Not sure now, are you?
All you need to know is we'll take very good care of you, okay? So we're going to look after you, and you'll be back with your mum as soon as you know. Good girl. Well done. All right.
Casey is first on Mr Bayard's list.
Right, come on in, Mummy. She can come have a seat on your lap.
Wow, look at this.
There's lots of people. Right, you have a sit on Mummy's lap.
Come on then.
Oh, look at that beautiful hair. That's amazing. My name's Susie and I'm going to help to look after you, okay?
With any procedure, even any appointment that you go to with a child, it's nerve-wracking because you never know, you just don't know what's going to happen, or you never know what to expect as much as people explain to you. It's still hard.
And then this arm under Mummy.
Oh,
Mama cuddle.
Big
Casey
hugs.
Lou, Susie's going to hold your hand now.
There we
Okay,
go.
well, just having a look.
It's okay, they're just looking at your pretty hands.
And we're going to give it a little wet wipe.
Where they did that
Do you like
butterfly.
bubbles?
You like bubbles?
Casey?
Look at Teddy, look. Look at Teddy sitting there. She's watching you. Did you catch it?
It
no.
bumped on your head.
Oh, are you okay? I thought you was a big brave girl.
It's going to have milkshake. Do you like milkshake?
You need a drink too. When this is all done, you can have a drink.
Okay, Mum, if she just sort of rests on you, she's going to start to
she'll
go a
just
little
get a
bit
bit-
tired. You're doing really well. Come on. Right, Casey, you may feel a little bit dizzy. That's all normal.
It's okay, it's okay.
All right, Mum, we're going to take her now, okay?
Just pop you on the bed.
Ready? Just watch those cables, guys. There we go. Just have to be very careful with their heads, okay? Do you want to give her a kiss, Mum?
Sorry.
She did brilliantly,
Thank
Mum.
you.
Star.
I was a little bit nervous, but I think things like that are always difficult for any parent. I'm looking forward to getting her back.
I puncture the sump. Can we bring the microscope over, please? Yep.
I have had many people say to me, what's wrong with her eye? And obviously she can see the difference in her eyes, so it obviously would be a problem as she's getting older.
Ruler, please. Marker pen. It's not a piece of wood. You can't cut it to the exact length. A muscle or any piece of body tissue has a certain amount of stretchability to it. If you overcorrect it, the person's eye, they have difficulty closing it. And obviously if you undercorrect it, then they still have a droopy eyelid. Marker pen.
Mr Bard must calculate where to make an incision to ensure Casey's eyelids are symmetrical.
Yeah, so it looks like the initial crease is there.
No, thank you. Yeah.
Yeah, see that side's 6. I think we need to put that at 6. I think it's the lower one actually. Lower one's exactly on 6. Local? Yep.
Local anaesthetic is used so Casey's eye is not painful when she wakes up.
See it blanch, couldn't you?
Extreme care is needed. If a nerve is severed, it could cause paralysis, making the eyelid droop further. An incision 3 millimeters deep is made.
Pull them buds.
Mr Bard needs full access to the levator muscle in case it has to be repositioned.
I don't have any sutures yet, Mr Bard.
No. So, the levator should be there. If you hold that one. Good.
The levator muscle can now be tightened or shortened using dissolvable stitches.
Skin glue.
Have a skin glue, Jane, please.
Glue is used to avoid external stitches. This should limit scarring and the chance of infection.
quickly.
2 red strings, 1, 2, 3, 4 sutures, 1 blade, 1, 2, 3, 4, 5, 6 hypodermics.
That'll be fine.
Yeah.
Okay. Yeah.
Lovely.
The operation has gone to plan. It's taken half an hour.
Where did you get your hat from? It's very blue.
Secret destination.
It's a bit like that colour. Tray.
Oh,
Yeah.
Can I put my shoes?
Yeah, you need to put some blue shoes on. Blue and green, never to be seen.
Red and yellow, ugly fellow. Have you heard that?
No.
Oh no.
What colour's my hat? Red and yellow.
Matthew Clark has come to have his broken nose reset.
I know how much is in there. By the window.
Ear, nose and throat surgeon Mr McPartlan will perform the operation.
Good morning.
Good morning.
Morning, it's Matthew.
Yes.
David McPartlan. Hi, we haven't met. I'm the consultant doing the operating list this morning.
Good, isn't it?
So, yeah, so I gather that was playing rugby?
Yes, yeah,
Okay.
Training of all things as well.
Training, yeah, okay.
So it wasn't even like a try-saving tackle or
Was it a
anything.
head or a knee or?
A knee to the face, yeah.
Since the injury, have you had any problems, nosebleeds or?
No, just a little bit of a bunged up nose, but that's about it.
So it feels congested?
Yeah, a little bit.
So what we can see is that the axis of your nose has been pushed across to the left side and you've got some bruising there and you've broken the nasal bone. So what we're going to try and do today is put you to sleep, a little look at your nose, and I'm going to see if I can just manipulate those bones back into the midline.
Yeah, okay.
Sometimes the problem is that despite your best efforts, you're unable to get the bones back into their original position, either because too much time has elapsed since the injury and the bones have knitted tightly together, or other times because they've just become very impacted. But on many occasions, despite your best efforts, the result that you get is not satisfactory from a cosmetic perspective. If, despite what we do today, you've still got a wonky nose that you're not happy with, what I would usually recommend is that we don't do anything till you stop playing rugby.
All right. Don't, because you'll be like, that's it, now.
Well, I wouldn't recommend stopping playing rugby, but we can do an operation to reposition things, you know, more formal sort of nose job, and rhinoplasty to put everything back into place. But when you do that, you sort of inherently weaken the nose a bit.
Of course, yeah.
So it's probably not worth doing it if you're likely to go out and get it knocked again.
Yeah.
But it's going to take up to 6 weeks for it to get, like any broken bone, to be fully healed.
Yeah.
So that doesn't, you could technically, of course, play rugby, but a relatively small impact on the nose could knock it out of place again.
Yeah, it's not worth it.
So it probably isn't worth it.
No.
6 weeks.
Yeah. Lots of shopping trips on Saturday, so I'm sorry about that.
Really?
Okay, right, see you shortly.
Lovely. All right,
Okay,
cheers,
bye
thank you.
now.
You know what this means, though? You've got to look after me. You've got to make me lots of cups of tea, make me lots of food.
I threw up on it.
Well, yeah, because I understand it can take time to get out of your body.
Yeah.
Hence why they say you can't drive. You can't make any life-changing decisions.
Apart from proposals.
No.
No.
Did you work there?
Morning.
Hello.
Morning. Got a list today with 5 cases on, although I'm told the last lady has not yet turned up. Second case, Matthew Clark. This is a 24-year-old gentleman. He injured his nose playing rugby and he's now got a deviation of his nasal axis over to the left side. So the plan today is to see if we can manipulate his nasal bones back into a better position. Hopefully we'll just be able to do it with the old thumbs.
In here?
If you're happy in here.
Happy? Yeah.
Okay, everyone happy with Mr. Clark?
Be all right. I'll be all right. I know you worry.
He's just a very cool person, and he just, like, he takes himself off to A&E by himself. He's quite calm and collective, whereas I just panic. You know?
No.
Do you need nervous way?
No. Am I nervous? Are you nervous?
Yeah.
I'm not, you are.
The next patient to arrive in day surgery has spent her entire life living and working in North Norfolk.
Morning.
Morning. I'm Norfolk, and I'm bloody proud of it.
Can I have your paperwork? That's lovely. Thank you very much.
With my accent, they said you're very Norfolk when you talk. You know, I class myself as very lucky, and there you go. You know, that's me.
That's lovely. Perfect. Thank you very much. Just have a seat.
Lovely.
Thank you.
I run a seafood kiosk. I do lobsters, crabs, all shellfish, and I do baguettes, which I fill with whatever you want. God, am I cool? It's hot.
Mary should have had her operation 6 months ago, but she insisted on waiting until the end of the tourist season.
I work 10 hours a day, 7 days a week. So then once you put the hatch up at 10 o'clock, that's it, the customers are there. I work on my own, and there would be no one to take my place, and so the hut would not have been able to function without me being there.
It means Mary has been working in pain for nearly a year.
I've stepped back off my doorstep and landed on the shingle, and my arm was underneath me, and it was a compound fracture with the wrist going back up into the arm. They operated and put a plate in it with 9 screws. A few months afterwards, when I was having a checkup, my surgeon said, is your hand okay? And I said, well, no. I said, it's hot. Got pins and needles. And I said, and it aches.
Perfect. Do you want to follow me through?
Oh, yeah.
Mary was diagnosed with carpal tunnel syndrome, where the nerve in her wrist causes constant pain.
Bay 3, bed space number 5.
Lovely, thank you.
Window view.
Yeah.
A room with a view. Surgeon will pop around, make sure you're nice and happy with what's going to go ahead today. Okay, and then we'll crack on from there.
Lovely, thank you.
Thank you.
She's a nice girl.
Orthopaedic surgeon Mr Nathan will perform the operation.
Hi. Right. So how's the hand doing now?
Yeah, the pins and needles are still in it. It's no better.
There's a nerve which goes in the center of your wrist, which is called the median nerve. And when it starts with the fracture and everything kind of scars up.
Yeah.
And there's a little tunnel there.
Yeah.
There's a carpal tunnel.
Yeah.
And that can compress the nerve. And that's why you're having the symptoms that you have, which is pins and needles.
You can't grip anything with that hand.
Yeah.
When you're trying to dress a lobster, you have to cut it in half, and you pressure on the hand. You have to cut baguettes. I mean, I'm cutting up probably about 150 baguettes a day.
Right, I'll see you soon.
Okay, look.
All right, take care, bye.
Bye-bye. Basically, I've got through. I don't know how I got through some days, because some days it's really bad, and night times it's awful. So you're not sleeping at night time because that's alive. I mean, if you ever get carpal tunnel, you'll understand what it is. Night times it's absolutely awful.
Four-year-old Casey Thompson is recovering after an operation to raise her drooping eyelid.
Don't do that.
Tracy and Chris are taking care of her.
Casey. Hello, baby. You're just waking up. Hi.
Here's Teddy. Here's Teddy.
You can't rub your eye, baby. We've got a special patch on your eye. Should we sit up a little?
There we go. Hello, honey. Beautiful.
Hence the teddy. Hold Teddy. Keep holding Teddy. There's a good girl.
She's fine, Mummy. She's just a bit sleepy.
Yeah.
She's got a little patch on her eye. It's very important that she doesn't rub her eye while she's all a bit sleepy and confused. Here's Mummy. Hello, Mummy.
No. Okay.
So we usually say if you can keep it on till morning, because they will rub their eye and sleep.
What's the matter, baby?
She's a good
Just
girl.
rub that one instead.
Yeah.
That'll do.
That would do. You all right? Hey. Teddy stayed with you. Teddy's still there. Look what Teddy's got. What's he got? Has he got a love heart? Wow, it looks just like you.
Is it better for now?
It will be better. Very soon. Okay?
I think so.
Nidgin, do you want to do rock, paper, scissors for who gets the hernia?
Rock, paper.
Rock, paper, scissors.
What's that?
Do you not play rock, paper, scissors before?
Yeah, you have to.
It's like flipping a coin.
Yeah.
So rock beats scissors, paper gets rock, and scissors cut paper.
Okay.
So yeah. So you go 1, 2, 3, and on 3 you do it.
Yeah.
You ready?
Yeah.
1, 2, 3. Ah! Well done. First game and he wins. Well done, Nidgin. He's just playing, he knows it all the time. So you get to choose now if you do the hernia or the lump, because you won.
I'll do the lump.
You do the lump, I'll do the hernia. Fabulous. Matthew?
Yep.
Yeah, you ready?
Yeah, I'm Michelle. I'm going to take you down to theatre.
Lovely,
All right, just stay there a minute. But results not.
Matthew Clark is about to have his broken nose reset.
Right, we're rocking and rolling, and I've got the kettle on for when you get back. All right? Fine. You'll be fine. Follow Michelle. You'll be fine. All right?
See you later.
Okay. We won't be long. You'll be fine. You'll be fine.
In 15 years of me playing rugby, I've never broke my nose, so I feel quite lucky. But now, not so, because I've got to have an operation.
Right, can we take your dressing gown from you, my darling?
This procedure is required so it doesn't affect me later on in life. Leaving a nose broken can cause all sorts of problems later on in the line in terms of sleeping and breathing.
While Lauren's talking to you, I will be putting some sticky pads on you. And I just want to undo this a bit so I can put my pads on.
My missus has said maybe I should be a little bit more careful. She's always there supporting me, but in the same breath I would say slightly concerned for my well-being on the field.
I can't wait till he's out and then I get to see him and I can make sure he's okay and look after him and take him home. Yeah.
What we're going to do is going to give you some oxygen with the face mask, okay? And in a short while I'll start the main medicine. You might notice this going up the arm, but that feeling will go, and then shortly after that you'll be asleep as well.
Start to think of something nice to dream of.
Yeah.
Nice holiday somewhere.
No allergies?
No allergies.
No metalwork or implants. Antibiotics not required. Glycemic control is not an issue. VT prophylaxis. So when we look at the nose, we have to bear in mind that only the upper third of the nose is bony and the lower 2/3 are formed by cartilage. So it's this bony part that has been injured due to the trauma that Matthew has sustained, and we're just going to try and return them to their original position by putting some force back in the opposite direction. I'm happy. This way.
Okay.
Yep. Got them deep enough. When we're breaking bones or manipulating bones, even experienced theatre staff still wince when they hear the bones cracking back into place. There we are.
I actually put my nails in my hand.
The fact that you can feel the nasal bones clicking back into place and you can see an instant improvement in the alignment of the nasal axis and you have a straightened nose is always satisfying. But it's probably one of the least sophisticated of the procedures that we do. You heard it click.
It makes you go, oh.
Yeah, it's quite stable. I think we'll just put steri strips on. It's not too mobile. That piece has just gone back in.
Makes me sweat.
She sweat.
Yeah. Cut the steri strips.
Just 6 minutes after going under anaesthetic, Matthew's on his way to recovery.
Matthew,
Claire will look after him.
it's all finished, Matthew. You're just in recovery. Just going to sit you up a little bit, Matthew. Matthew. Hello. It's all finished. It's all done. You're just in recovery. Take that off. Don't rub your nose. Don't rub it. Okay, it's all finished. You're in recovery.
Lovely.
Okay.
Well, a cup of tea, I think.
Very soon. Don't rub your nose. Keep your hand down. That's it. Can get you some water to drink in a moment, and we'll get you a cup of tea when you're back on the ward.
Is it Twinings?
Oh, NHS, I'm afraid.
I should have brought some tea bags.
You might want 2 tea bags, I warn you.
Where's the old missus? I think she's gone spare.
Got a bit of an off-the-shoulder look going on with your gown. You're flashing everyone.
Don't be sorry. First question. Have I got black eyes?
It looks like it's old
You're right.
bruising.
Yeah, lovely.
They're no more bruised than they were before.
Oh, that's all right.
So the fracture went back with quite a nice little click.
Yeah,
and it felt quite stable, so I haven't put a whole plaster cast on, okay? I've just put these little dressings over your nose just to remind you you've had something done and to hold it in place.
I don't look like Michael Jackson.
No.
Good.
Did you want to look like Michael Jackson?
Seriously.
Can you sing like Michael Jackson?
Lovely. Right. Come top, my G.
Cup of tea first, don't forget.
Oh, I'll tell you what, lovely.
Oh.
I'm bearing a gift.
Mary Wasey is waiting for a carpal tunnel operation. She's suffered extraordinary pain in her wrist for nearly a year.
There we are.
Thank you.
No problem.
Mary's surgeon is Mr Nathan.
Right, okay, so we've got 4 kids on the list. The first one is Mary Wasey. They are usually present with pins and needles affecting the fingers, burning sensation, and as the compression gets worse, they start getting muscle weakness. They can't turn a key or pick up things, finding it very difficult and painful, and the pain being worse at night, and just keeps them awake and affects the rest of their lives.
So this is where the aggro is, across all the way around the wrist, and in here, you could really, I mean, that is tender to touch.
Right.
Still. I just want it done. I just want it. So it's only my job, but stop me from having it done. It will be a tremendous relief to get it done.
Mary is 67 and works long hours on her own in a seafood kiosk on the coast.
My husband passed away in March of last year, which was a shock. It was very, very sudden. Nobody expected it. We'd been married for 45 years, and I was sort of like getting ready to retire. And but then when you find you're on your own, you thought, you can't retire. How can you retire? You know, when there's 2 of you, that's more financially sound, isn't it?
Right, my lovely. What we need you to do is pop yourself up on the bed. This is for your arm here. That's it.
Yep.
Hello there.
Hiya.
I'm wearing a mask. It's the same person who spoke to you earlier on.
Yeah.
And I'll keep telling you exactly what I'm doing as I go around, all right?
Okay, it's moved up there.
Mary will only have a local anaesthetic.
Right, a sharp needle coming.
I don't like needles. I don't like that bit.
Nobody likes needles,
No.
really, do they, darling?
That must be going a bit numb, isn't it?
Yeah.
Good.
Feels heavy.
Yes, yes, yeah, it would do. We need to cut off the blood supply coming down to the wrist, so we use a big black inner tube which squeezes the blood out. When we're using a tourniquet, we have only a certain amount of time, so we need to work quick so that the muscle doesn't deteriorate.
Mr Nathan is assisted by Dr Setu Kavala.
Right, do you feel anything sharp? Anything sharp?
No, nothing?
No.
No? Very good.
Obviously, if you do feel anything, you'll feel pulling and pressure.
Yeah.
If you feel any pain, you let us know, okay?
Well, we already started the procedure.
No, yeah, that's fine.
You okay there?
Yep.
Yeah, she's fine.
The incision has to go deep enough so that we can expose the top of the carpal tunnel to see the nerve. See that white tissue? That's part of the flexor retinaculum. That's the one which forms the roof of the carpal tunnel, and that's what we're going to decompress. I need to open the roof of the tunnel. If you cut the nerve, it's pretty disastrous. The patient will lose sensory function and also muscle function, leading to paralysis of the small muscles of the hand. And you'd see a slimy thing just underneath that, and that's the nerve. You might feel a little bit of tingling because you're very close to the nerve, so don't worry about it. Yeah, that's a tendon, but the one close to it is the nerve.
Once the surgeon has cut through, the trapped nerve is freed.
So you see that's the tunnel there. See how much it goes in. So that's nice and free. So there's no pressure there. And that's it. Right, we're just going to stitch up now. It's all done.
Okay, yeah, lovely, thank you. That don't take very long, does it?
No, not at all.
So these stitches are dissolvable ones. So you don't have to take them out.
No.
Just put your hand there. But you will see a GP in about 10 days where they will trim the stitches down. It doesn't have to be completely taken out. Do you want to have a look? All right,
oh, no, that's okay. No.
Yeah, this is going to be a really bulky dressing.
Yeah.
That's the one that gives you all the sympathy.
Yeah, what have you done?
Once the procedure is finished, we let the tourniquet down and the blood gushes down the arm, and this can give you an odd sensation. There's your hand back again.
Yeah, thank you. That's full of pins and needles.
Yeah, that's because the pressure suddenly released.
Yeah.
You feel that thing come out, just exactly the symptoms that you had before the operation. But that'll settle down. Once it gets well perfused, you'll be all right.
Yeah,
There's nothing to worry. It went on very well. All right?
Yeah, lovely.
Okay. I'll come and see you in the ward in a few minutes.
Yeah, thank you.
Cup of tea?
Yo. No, you're my best friend.
Oh, well, that's good.
Thank you, madam. Thanks very much.
Right. All okay?
Yeah, fine, thank you.
Right, okay. So the important thing is, I know it's numb now, you feel a bit numb, but keep moving your fingers. That's the most important because they do kind of stiffen up very quickly.
Yeah, that's still feel all the way down here and all the way through there, full of pins and needles, but that will wear off.
That'll come up. But keep moving your fingers, keep it up. Importantly, just keep moving your fingers. It's very, very important.
Like that?
Yeah, for the first couple of days to help the swelling to come down. But like I said, everything went on fine.
Okay, lovely. Thanks very much.
All right?
Yes, thank you.
Thank
You
you.
did a lovely job, though. I didn't feel a thing.
You're welcome.
Except for those needles.
Thanks so much. Take care.
Thank
Bye.
you. Bye-bye. Bye-bye. I've now got 5 months to recover and to get that hand working up and going for opening up my business next March. Touch wood, I'll be able to go in that hut, bang, straight away. The lobsters won't know what's in.
After 25 minutes in recovery, Matthew Clark is heading back to girlfriend Holly.
I'm all right. I'm all right. All right.
I'm fine. I had a lovely little sleep. And then it felt the old anaesthetic go up the whole of my veins. And then I had a little breathe, and then that was it. You might just mind the nose. All right.
You're right, you're right. We'll get you a drink.
Lovely.
What
Well,
would you like?
I said Twinings, but you ain't got
Yeah.
none. So what I'm going to do next time I'm here, I'll bring some with me.
Ah, bless you.
Not there's going to be a next time, Spawn.
Yeah.
That was quick, wasn't it?
Oh my word.
I know.
I can't wait.
You're my world too.
Hi.
All right.
I'm okay. How are you?
Yeah, I'm lovely. It didn't take long, did it?
It's not a very long procedure. It's just whether it shifts or not. And in your case, it did.
Did, yeah.
So we got the bone to shift. So
like,
your good looks are preserved. You'll be fine.
thank God for that.
It's just 5 days until Matthew's sister gets married.
So has he got to keep it on for a week?
I would try and leave it on for a week. Yeah.
Yeah.
Okay.
And then
Sister's
they'll
wedding.
just peel off. Well, take it off before. When's the wedding?
Saturday.
Take it off before then.
Winner.
Yeah.
Happy days.
All right.
Yeah, lovely.
Good. All right. Take care.
Thank you. Cheers.
Bye now.
But it's not the only wedding on Holly's mind.
Well, no, I don't think I said that.
No follow-up. No sports for 6 weeks.
Lovely.
Lovely. Thank
Good
you very
stuff.
much. No,
Pleasure
thank
looking
you.
after you.
Matthew's nose healed perfectly. He has sustained no further rugby injuries. Casey's vision has improved significantly. Her eyelid still droops slightly, and Mr Bard is considering another operation to raise it further.
Bye-bye, thank you.
Thank you. Bye.
Mary's hand is much less painful, although she still struggles to grip things. But she's on course for getting back to work in time.